Your feet might already know something your last blood test didn't catch. That's not a scare tactic, it's actually how diabetes often works, and by the time we get to sign number 7, you'll understand exactly why doctors say the feet can talk before the labs do. Stay with me, because one of these 9 signs gets brushed off by almost everyone who has it, until it isn't something small anymore. Welcome back to Prime Health Insight. I'm glad you're here because today's topic is one that quietly affects millions of families, and most people never connect the dots until a doctor points it out for them. Let's get right into it. I want to start with someone I'll call Walter, because his story is the reason I think this topic deserves more attention than it usually gets. Walter was 66, still mowing his own lawn, still felt perfectly healthy in his own words. For about 4 months, he noticed his toes felt a little different when he took his socks off at night, sort of like they were wrapped in an extra layer of fabric that wasn't actually there. He figured it was his shoes. It wasn't until his daughter noticed a small cut on his heel that hadn't healed in almost 3 weeks that anyone thought to check his blood sugar. It came back at 230, well into diabetic range. Walter had 4 of the 9 signs I'm about to walk you through, and he hadn't connected a single one of them until that moment. Looking back, he told me the signs had actually been there for months, quietly, waiting for someone to notice. That's exactly why your feet matter here. Think about how much you ask them to do every single day without ever really thanking them for it. They carry your full body weight through thousands of steps. They absorb the impact of every stair you climb, and they're usually the last thing on your mind until something actually hurts. People notice a headache or a sore shoulder almost immediately. The feet, way down at the bottom, tend to get ignored right up until something is seriously wrong. There's also a simple reason your feet specifically tend to show trouble first. They're the farthest point in your body from your heart, the last stop for blood flow, and often the first place circulation problems show up. According to the CDC, roughly 1 in 8 Americans is currently living with diabetes, and more than 1 in 4 don't know it yet. Diabetes is also the leading cause of nerve damage and circulation problems in the lower body. So if your feet are sending you a signal, it's often arriving well before a lab result would. Sign number 1 is numbness or tingling in your toes and feet, that pins and needles feeling, or the sense that your foot never quite woke up all the way. Picture your nerves like the electrical wiring running through a house. When blood sugar stays high for a long time, it slowly damages the insulation around that wiring, and signals start arriving late, or not at all. For some people that shows up as tingling. For others, and this concerns me more, it works in reverse. Feeling fades instead of intensifying. That's more dangerous, because pain is your body's fire alarm. When the alarm goes quiet, you can step on something sharp and never know it happened. The tricky part is how gradually this creeps in. Most people just assume their shoes got tight or they slept wrong, but nerve damage from blood sugar doesn't resolve itself the way a pinched nerve does. If this feeling has lasted more than a couple of weeks, that's worth mentioning to your doctor, and a nightly foot check by hand, not just a glance, is the simplest way to stay ahead of it. We'll come back to exactly how to do that properly a little later. But that wasn't the biggest surprise in Walter's story. Sign number 2 is what actually got his daughter's attention, a cut, blister, or sore that simply won't close. A normal cut scabs over in a week or 2, your body sending in new cells to close the gap on a predictable schedule. When blood sugar runs high for a long stretch, it thickens the blood slightly and narrows the smallest vessels, so oxygen and nutrients arrive at the skin more like a delivery truck stuck in traffic than one running on schedule. Healing slows down, sometimes dramatically. Pair that with the numbness we just talked about, and you get exactly what happened to Walter, a wound nobody even knew was there. If any cut on your foot is still open after 2 or 3 weeks, that's not a wait-and-see situation, that's a phone call to your doctor. There's a compounding effect here worth understanding too. When numbness and slow healing show up together, the way they did for Walter, a wound can sit there completely unnoticed for far longer than it should, simply because there's no pain to flag it. It's not that a small cut is dangerous by itself. It's that the normal warning system, the pain, the redness, the expected healing timeline, can all go quiet at once, which is exactly how something small turns into something bigger before anyone realizes it's happening. This isn't a minor detail either. Infected foot wounds are one of the most common reasons people with diabetes end up hospitalized, which is exactly why doctors treat a slow healing cut on the foot so differently than one anywhere else on the body. Here's where things get a little less obvious, and it's a sign most people blame entirely on the thermostat or on simply being someone who runs cold. Sign number 3 is feet that feel cold to the touch, even when the rest of you feels warm, even through thick socks. Think of your blood vessels like garden hoses. When they narrow from years of elevated blood sugar, less warm water, in this case blood, reaches the very end of the hose, which is your feet. Some people notice it in one foot before the other, which is actually a stronger clue than both feet feeling cold at once, since a general chill usually affects both sides evenly, while a circulation problem often doesn't. This kind of circulation change doesn't happen overnight. It builds slowly over months or years, which is exactly why people adjust their habits without ever stopping to ask why. If you've quietly started keeping a blanket by the couch or reaching for thicker socks without really asking why, that's worth noticing. The next sign is one most people would never think to actually test for, even though it takes about a minute. Sign number 4 is a change in skin color on your feet or lower legs. A reddish or purplish tint, a bluish tone, or patches that look darker than the skin around them. Changes that are easy to miss if you're not specifically looking for them. Walter mentioned once, almost in passing, that his feet had looked a little more purple than usual that winter, and he'd chalked it up to the cold. Try this tonight. It takes about a minute. Sit somewhere with decent light, prop your feet up for 60 seconds, then set them back down flat and watch what happens. If they go noticeably pale while raised and then flush deep red once lowered, that's a specific pattern doctors check for during a circulation exam, and it's easy to test for yourself in less time than it takes to brush your teeth. It's one of the few signs on this list you can actually confirm at home, rather than just watching and wondering. Most people spend money on lotion trying to fix this without realizing lotion isn't solving the actual problem underneath it. Sign number 5 is dry, cracked skin, especially around the heels. High blood sugar can damage the nerves that control sweat glands in the feet, so the skin simply stops producing the moisture it used to. Those cracks aren't just a cosmetic nuisance, they're doorways bacteria can slip through, which loops right back to that slow healing problem from sign number 2. Most people treat cracked heels as purely cosmetic, something for a pumice stone before sandal season. There's nothing wrong with that, but it's worth reframing a little. When dryness gets severe enough to cause real cracks, that's your skin telling you it's lost some of its ability to protect itself, not just that it needs lotion. Now, quick question for you, and I actually want you to answer this one in the comments. Out of the 5 signs so far, numbness, slow healing, cold feet, skin color changes, or dry cracked skin, which one sounds the most like something you've noticed in yourself or in someone you love? Type the number. I read every comment, and it genuinely helps me decide what to cover next. Sign number 6 is recurring fungal infections, athlete's foot that keeps coming back, or toenails that have gone thick, brittle, or discolored no matter what cream you try. Elevated blood sugar essentially feeds the organisms that cause these infections, the way leaving sugar out on the counter draws ants, and warm enclosed shoes give those organisms exactly the environment they thrive in. A weakened immune response, which often comes along with elevated blood sugar, also makes it harder for your body to fully clear the infection on its own, which is part of why the usual over-the-counter treatments seem to work for a while and then stop working at all. Treating the infection without addressing what's feeding it just means it comes back in a few months, and that frustrating cycle is often the actual clue worth bringing to a doctor, more than the infection itself. That frustrating cycle was actually part of Walter's story too, though it took his family a while to put it together. He'd been treating athlete's foot on and off for almost 2 years, always with the same over-the-counter cream, always watching it come right back a few months later. Nobody thought to connect it to anything else until the bigger picture started coming together. Now here's sign number 7, the one I told you about at the start, and it's the one that fools almost everyone because it doesn't look serious at all. It's swelling in the feet and ankles that shows up by evening and doesn't fully disappear overnight. Most people blame their shoes or a long day on their feet, and sometimes that really is all it is. But when it becomes a pattern, instead of an occasional thing, rather than something that clears up by the next morning, it can reflect how blood sugar is affecting the kidneys and blood vessels over time, a little like a water filter that's been working overtime for years and is starting to fall behind. Try this test tonight. Press a finger gently into the skin just above your ankle. If it leaves a small dent that lingers for several seconds instead of springing back, mention that to your doctor at your next visit. The last 2 signs on this list are the quietest of them all, the kind that don't look like a medical problem at all, which is exactly why they get missed the most. Quick one before we get there, how many of these first 7 have you actually checked for on yourself? Be honest, even in your head. It's not a test, it's just worth noticing. Sign number 8 is rarer, and it's a genuine change in the shape of the foot itself, sometimes called Charcot foot. In cases of significant nerve damage, the small bones and joints in the foot can shift and weaken without much pain at all, because the nerves that would normally send a pain signal have gone quiet. Over time, the arch can flatten, and the bottom of the foot can start to look rounded, almost like the base of a rocking chair. It usually shows up gradually, sometimes noticed first, not by the person themselves, but by a spouse or family member who says, "Your foot looks different than it used to." This is also part of why regular podiatry visits matter, even when nothing feels wrong, since a trained eye can sometimes catch structural changes before they've progressed very far. And sign number 9, the one people write off the fastest as simply getting older, is hair loss on the lower legs and feet paired with skin that looks unusually shiny or tight. Most people assume thinning hair on the legs is just a normal part of aging, and often it is. But doctors looking specifically for circulation problems see this pattern very differently. Reduced circulation affects hair follicles the same way a plant struggles without enough water, growth slows, and eventually stops in that spot. The clue doctors actually look for isn't hair thinning in general, since that happens to everyone to some degree. It's hair loss that's clearly more pronounced on the lower legs specifically, especially alongside that tight, shiny skin. It's subtle enough that most people only notice it when they compare an old photo to how their legs look now and are surprised by how much has actually changed. It's rarely the sign that sends someone to the doctor on its own, but paired with any of the others we've covered, it rounds out the picture rather than standing alone. So that's the full list. Numbness, slow healing wounds, cold feet, skin color changes, dry cracked skin, recurring fungal infections, swelling, changes in foot shape, and hair loss with shiny skin. On their own, any one of these could be nothing at all. Dry skin can just be dry skin. Cold feet can just mean you run cold. Swelling after a long day on your feet is common and usually settles within a day. But when 2 or 3 of them show up together or stick around for weeks without explanation, that's the exact pattern doctors look for during a diabetic foot screening, and it's worth an actual conversation, not a guess. Knowing the list is one thing. Actually catching these signs in your own life is a different skill entirely, and it comes down to a few habits that take almost no time but make a real difference over months and years. Let me walk you through those now. Now that you know what to look for, let me give you the practical piece I promised earlier, the actual right way to check. Most people glance at the tops of their feet while putting on socks and call it done. The bottoms of your feet are where a lot of these changes actually show up first, and they're also the hardest place to see without help. A hand mirror propped on the floor works well, or simply lifting each foot onto the opposite knee while you're sitting down, whichever feels easier to keep up with night after night. Run your hand over the skin too, not just your eyes, since some changes in texture are easier to feel than to see, especially in dim lighting. It takes less than a minute once it becomes a habit. While we're talking habits, footwear deserves a quick mention because it touches nearly everything we've covered. Shoes that are too tight can restrict circulation further, and shoes that are too loose can create friction and blisters you might not even feel if numbness has already set in. Shopping later in the day, when feet are at their largest, and choosing a wider toe box does quiet work every single day for feet already dealing with reduced circulation or sensation. Nail care fits into this same category. Trimming nails straight across rather than rounding the corners and not cutting them too short helps avoid exactly the kind of small nick that can quietly turn into the slow healing wound we talked about earlier. It's also worth knowing where you might be at higher risk. The odds climb the longer someone has lived with elevated blood sugar, whether or not it was ever formally diagnosed, and they climb further for anyone who smokes, since smoking narrows blood vessels much the way high blood sugar does. Blood pressure and cholesterol matter too, for the same reason, since they affect the same vessels we've been talking about this entire video. Age itself plays a role as well, simply because these changes tend to accumulate the longer any of these factors have been present. None of that means these signs only matter if you check every box. It just means the more of them that apply to you, the more worth it that nightly check becomes. If you've never had a diabetic foot screening, it's quick and it doesn't hurt, usually just a visual check, a pulse check at the ankle, and sometimes a small filament, a bit like a soft bristle, touched gently to different spots on your foot to see whether you feel it consistently. The whole thing typically takes a few minutes, and it gives your doctor real information rather than a guess based on how your feet happen to look in the waiting room. If it's been a while since anyone specifically looked at your feet during a checkup, that's a perfectly reasonable thing to ask for directly. I want to be clear about something before we wrap up. This video is meant to help you notice patterns, not to diagnose you and not to make you anxious about every small change in your body. Plenty of these signs have completely harmless explanations on their own. A basic blood sugar test is quick, painless, and gives you real answers instead of leaving you to wonder. And if it does turn out your numbers are elevated, catching it early gives you far more options through diet, movement, and daily habits, long before anything more serious develops. Movement in particular deserves a mention here, since even a short walk helps your muscles pull glucose out of your bloodstream and genuinely supports the same circulation we've been talking about this whole video. It's a little like opening a second checkout lane at a busy store, giving the excess somewhere useful to go instead of just sitting in the bloodstream. Nobody needs to overhaul their whole life overnight. A short daily walk, a bit more water, one less sugary drink a day, small and steady tends to beat dramatic and short-lived. And if you're already managing diagnosed diabetes, staying consistent with medication and follow-up visits does more for your feet indirectly than almost anything you could do to the feet themselves. I want to mention one more patient before we close, a woman I'll call Diane, 72, who'd actually managed her diabetes carefully for over a decade and always assumed good numbers meant her feet needed no extra attention. She checked her blood sugar diligently every single morning, and in her mind, that discipline was enough. What she hadn't been doing was actually looking at her feet closely, because good numbers to her meant nothing down there needed watching. A routine podiatry visit caught a small area of thickened, discolored skin on the ball of her foot that she'd never have noticed on her own. Her case is proof that even well-controlled blood sugar doesn't remove the need to actually look, since some of these changes build up quietly over years, regardless of what your numbers say. Her outcome was simple in the end: better fitting shoes and regular visits, nothing dramatic, and she told me she now checks her feet every night the same way she checks her blood sugar every morning. If Walter's story sounded familiar, even a little, do one thing for me. Take off your socks tonight and actually look, not just glance, at the top and bottom of both feet. It takes less than a minute, and it's one of the simplest habits doctors point to again and again for catching problems early. Walter's story had a genuinely good outcome. Because his daughter caught it when she did, his treatment was straightforward: some medication, a change in daily habits, regular checkups, nothing dramatic. That's really the whole point of this video. The earlier this gets caught, the simpler it usually stays. If this helped you understand something new, share it with someone you love, the kind of person who'd rather hear it from you than find out the hard way later. Sometimes the people closest to us are the least likely to notice these things in themselves, and a video shared at the right moment can be exactly the nudge someone needs. The same way Walter's daughter noticing one small cut ended up changing his whole trajectory. If you're new here, consider subscribing. Every week we cover the kind of practical health information people usually don't hear until they're already sitting in a doctor's office. And I'd rather you hear it here first, while there's still time to do something about it. Thanks for spending this time with me today. I know a topic like this isn't the most exciting thing you'll watch all week, but it's the kind that matters most in the long run, the kind of ordinary, unglamorous attention that quietly protects your independence for years to come. Take care of yourself and take care of those feet. I'll see you in the next one.